What threatens the effective prevention and treatment of an ever-increasing range of infection caused by bacteria, parasites, viruses, and fungi. That is antimicrobial resistance, abbreviated as AMR. It is an increasingly serious threat to global public health that requires action across all government sectors and society. This is Saurabh Bhalla, an associate lifetime member of Indian Pharmacy Graduate Association, along with my teammates Prachi Verma and Mehak kanojia, presents our project on antimicrobial resistance surveillance system. So, what is exactly antimicrobial resistance? AMR occurs when bacteria, viruses, fungi, and parasites change over time and no longer respond to medicines, making infections harder to treat and increasing the risk of disease spread. As a result, the medicines become ineffective and infections persist in the body. It refers to a microorganism's resistance to an antimicrobial drug that was once able to treat an infection by that microorganisms. Antimicrobial resistance is a growing public health problem, and India carries one of the largest burdens of the drug resistant pathogens worldwide. Regional studies report high AMR among pathogens such as Salmonella. Standardized surveillance data for AMR is necessary to understand the extent of the problem and temporal trends in resistant in order to prioritize threats and target countermeasures. For this, India introduced the National Action Plan on AMR, which was released in April 2017. The National Action Plan on Antimicrobial Resistance, drafted by Ministry of Health and Family Welfare to efficaciously obstruct antimicrobial resistance in India. Here we consider the purpose of AMR surveillance in the execution of the plan of action. It involves the collection of antibiotic susceptibility test results. Labs under National Antimicrobial Surveillance Network are necessitated to submit AMR surveillance data of 7 preeminent bacterial pathogens of public health. Our proposal project manifests the key elements of system to be enhanced, where we firstly discuss of targets, which are to educate healthcare workers to reduce healthcare cost, enhancing IPC, ensure optimal use of antibiotics, and supporting surveillance of AMR. Following with inputs like red line campaign, escalation of surveillance system on a broad spectrum, and international collaboration and stewardship. The interventions that we encountered are restricting medically antibiotic use, dearth of new antibiotic being developed, evaluation of great size data, and inappropriate medical waste management. The solutions that we proposed are tie-up of political leaders and scientific researchers, education and training of pharmacists, increasing awareness in AMR surveillance, creating awareness and ground level and targeting quorum testing. The exposed outcomes of the proposal are reduction in antibiotics consumption, surveillance uphold, decrease in impatients, reassessing treatment after culture results, and drug expertise as well.
Pressing ahead to the SWOT analysis of our project, moving with these trends, the CDSO embraced different policies in almost every area: involvement of quorum sensing, enhancement in inspection and growth of the surveillance system, inclusion of political leaders and researchers, upgradation in quality assurance, and scrutiny of registration of antibiotics by NRA. Besides, weaknesses comprises of incompetence of regulatory bodies, misinterpretation of AMR among general populace, poor implementation of stewardship. Now coming on to the most intrinsic factor, that is opportunity. Outline of our proposal lay out several chances for healthcare workers to advance and extend our diagnostic mechanics and technology for superior drug evolution, for international collaboration, and opportunity for scientific researchers as well. Winding up with the threats involved in our project: stepping out of the funds by the middlemen, equipment breakdown, inaccessibility to new technologies and drugs to remote areas, biomedical environmental pollution, patient data leakage and confidentiality concerns, and increased cost of antibiotics due to the introduction of new ones. As we have stated in SWOT analysis, that which are the main areas to focus out of them, incompetence of regulatory bodies is the foremost area to work upon. Before reprising the solutions, let me spell out its implications, which includes primitive guidelines, no strict enforcement of policies, regulatory approach without enforcing compulsion on the training sessions are to no purpose, unaffordability of advanced antibiotics.
We can lessen these implications with the assistance of these solutions. Primarily, introducing smart regulation. This concept will embrace more flexible, imaginative, and innovative forms of social control than conventional regulation. Secondly, by digitalizing the data reports and charts, will render a better understanding of the data available to the policymakers and other stakeholders, expediting the result-driven record at national level. Effective regulation is one of the solutions for empowering the system. Restricting the use of antibiotics for non-therapeutic reasons can be done to enforce optimum use of antibiotics. Besides, separate management committees can be set up for the sectors like retail pharmacies, hospitals, poultry farms, and pharmaceutical industries to inspect AMR-related infections and their weight. All this will be more impactful if it goes in tandem with global collaborative action. NEPs need to be globally assisted and locally focused with realistic context-specific expectations. The outcomes which are supposed to come about are filling of AMR data gaps, track on whether new policies have been approved and training has been conducted, enhancement in inspection and growth of the surveillance system, upgradation in quality assurance and scrutiny of registration of antibiotics by NRA. Eventually, we would like to conclude by mentioning that to combat the impending danger of antimicrobial resistance, an effective regulation is essential to successfully tackle AMR while ensuring access to appropriate and affordable antimicrobial treatment when needed. The ideas and strategies inculcated in our proposal will lead to an empowered regulatory body which is significant in the mitigation of this AMR crisis.